Well, we're here with Lester today. Lester's been a patient here now for about, I don't know, 6, 7 weeks, I guess, Lester.
About 6 weeks.
About 6 weeks. He came here with some pretty challenging health issues. Lester, briefly tell us what brought you here. What kind of issues were you having?
Well, most of all, I'm suffering with neuropathy, polyneuropathy. When I first came here, I knew I could barely walk, having sleep issues, pain all over from my head to my toes, balance was a major issue, concentration. I could not concentrate a lot, a lot of memory loss, it's been phenomenal.
So, and you'd seen a number of other doctors previous to this. What kind of docs were you seeing?
I've seen pain specialists, pain management from the top hospitals here around, Emory, Atlanta Medical, and all of them were the tops in their field. Started off first maybe taking about 8 or 9 different types of medication.
Right.
And also, since I've been here, I've actually lost up to, I think, about 18 pounds in total.
Yeah, about 18 pounds you lost in these few weeks.
And I feel a lot of energy. Before I didn't have that much energy, but now I do.
You were taking a lot of meds, you really weren't getting a lot better, your life wasn't looking too good at that point, was it? So what kind of interventions did we do? What have we done?
I've been doing brain paint, helps me to concentrate and focus more. I've also done as far as my stretch,
the
decompression therapy
right.
that has helped me loosen up a lot of the pain. Also a lot of special types of structure as far as my body pain relieving, and that's you're doing, I guess it's more of this nerve conduction.
Right, a little bit of neurological interventions, neurological treatments, chiropractic treatments.
Chiropractic treatment.
So it's been fairly intensive, but you've also been very dedicated in making some changes.
Yes.
And we're just early into the care plan at this point in time. So at this point, are you pleased with what has occurred?
Yes, I would feel miserable if I don't come here.
Okay, well that's good.
Because it's a motivation to me, because I can see the improvement and my wife can see the improvement, and so it's no need in stopping.
All right, well cool. And you mentioned brain paint. Now brain paint is a neurofeedback program we use that helps to restore kind of normal brain function and normal brain function. I think this has been a real benefit to you as well as you've gone through this.
Yes. I had also some issues of outbursts of anger, and that has come pretty much down.
Your wife appreciates that.
Yes,
right? Yeah.
And sleep issues, where I would not have much sleep at all.
Right.
So I'm able to get some rest now.
You had mentioned earlier that your pain had gotten so bad, particularly in your feet, that you got where you couldn't drive.
Yes, I mean, it was embarrassing at first, where I really wanted to take my legs off. It was just the same, I would say cut my feet off, because it was just too much pain to bear. And even having someone to drive me, that was embarrassing all the time when I want to move. But now I'm able to drive a bit.
Because you actually drove here today.
Yes.
Yeah, that's good.
Yes.
All right, we appreciate you taking a few minutes, and we're just getting early into the care. Hopefully as we progress, we'll see continued improvement, and we'll be back in a couple of 3 months and talk again. Thank you a lot, Lester. We appreciate it.
Thank you. Thank you, Dr. Paul.